It's recording.
Okay.
Welcome to OPA's Oral History Interview Series. Today we are interviewing Dr. Gerald Strauss, who's currently a psychologist with the Veterans Administration and former president of OPA. Dr. Strauss, I wonder if you might begin by telling us a bit about why you became a psychologist, what in your background led you in this direction, and something of your educational experiences.
Sure. Thanks for having me today, Dr. Reinerson. It really started before graduate school. So going back to probably 1970, I was an undergraduate at Kent State University, and was an English major, actually. And as you know, 1970 was a pretty dramatic year at Kent, and I did my fair share of protesting and so forth. And after I got into my third year at Kent and then dropped out. I'd found out about another program at Cuyahoga Community College up in Parma, Ohio, and they had a physician's assistant program. They had two, actually, one that was for primary care and another one that was for surgery. And I've always had an inclination to dabble in medicine, and so I thought this was a good introduction to it. So I applied to the program. They said I needed some hospital experience, and so I got a job as an orderly at Akron General Medical Center. So started there. I was an orderly in the X-ray department, and that's where I met my wife. She was an X-ray technician. So I worked there for a bit of time, about a year, and then entered the Tri-C program, and that was 2 years, from 73 to 75. Finished that, and started working in that career at Lutheran Hospital in Cleveland. So it was a very enjoyable career. I really liked working in the operating room and the intensive care unit and so forth. So after doing that for a while, I thought maybe I'd want to go to medical school. And so I started moving in that direction, taking more classes in chemistry, organic chemistry. And around the same time, I started doing some reading about behavioral medicine. And so I decided to go to a conference to see what this was all about. So I went to Boston. And so I'm in this convention hall, and I'm listening to people talk, and there were people there that I'd never heard about. Herb Benson was one of them. John Kabat-Zinn was another one. McClellan from Harvard. I'd never heard of these people. Joan Borisenko and her husband, I forget what his first name was. So they were all on this panel, and so afterwards it was around 12 o'clock and they were getting ready to break for lunch. And I had a question for Benson about some cardiac physiology thing. So I went up and talking with him, and he said, hey, we're going to go to lunch. You want to come with us? Sure. So here I am sitting at lunch with all these people that come to find out are pretty well renowned, and I had no idea who they were at the time. It was a fun experience. And so from that I started reading more about behavioral medicine and thought, this is the route I want to go. I can combine what I know in medicine with psychology and then make a career of that. And I also asked myself, do I want to be in my 50s and be in the operating room at 3 o'clock in the morning? I'd had 8 years of that experience, and I thought perhaps I'd want a different track. Had I gone to medical school, I'd be a vascular surgeon today. So that then led me to finishing my undergraduate degree at Baldwin-Wallace College at the time, it's Baldwin-Wallace University. And then from there, actually, Mike Dwyer, who is another past president of OPA, was my primary advisor at Baldwin-Wallace at the time, and probably is one of the big reasons as well that I went into psychology.
And he's still at Baldwin-Wallace.
He's still at Baldwin-Wallace, yeah. Probably soon to retire, but yeah, he's still there. So I owe him a lot as well. There are just so many people that I owe a lot to in terms of mentoring and shepherding me along. The other thing I found out when I was working as a PA is people, for I don't know, whatever reason, enjoyed talking with me. Physicians, nurses, I mean, they would kind of seek me out, you know, if they were having trouble at home or just trouble at work, and they'd want to sit down and chat with me about things. So I think there was a part of that was enticing to consider psychology as well as this behavioral medicine psychology match. So for me, it was a good decision. So I went on to Kent State, did my master's and PhD at Kent State, did my internship at the Cleveland VA, and then after I finished my internship, that was 86, 87, I stayed on at the VA and have made a career of the VA in part-time private practice with you as well since that time. So I've been at the VA for 27 years.
In your beginning years at Kent State, were you there during the riots?
I started in September after the shooting was in May of 1970. I started in September. But there certainly were a lot of demonstrations and a lot of clashes with the local police. They never called the National Guard back out again, but certainly the Sheriff's Department, the local police, and so forth. There were a number of run-ins with them and some tear gas and clubbing involved as well.
And I seem to recall that you also were involved with Town Hall 2 helpline.
Not so much the helpline, but I was involved in Town Hall 2 in their lab. So I would, draw blood on people and do urinalyses and those sorts of things. But that was way before. That was actually before I went to PA school, and I think I was trying to get some additional experience to demonstrate that I could do well in the PA program. So I wasn't on the call.
You've had a varied background, which certainly has prepared you for what you do today as a psychologist. Could you tell us a bit about what your typical day is like and your role at the Cleveland VA Hospital?
Sure. Yeah, the VA has been just a wonderful career path for me, and I think for anybody that works at the VA. There are just so many different things that you can do. If you tire of one thing, you can move on to a different area. So when I started in pain management and spent a number of years there, eventually moved on to part-time pain, part-time CL psychiatry, and then about 20 years ago, the then chief of medicine asked if anybody in psychology could come down to teach the medical residents about tobacco cessation. Nobody wanted to do it, so I thought that might be interesting. So I would go down a half a day a week, and I would give a little lecture to the residents about tobacco cessation. And then I would hang out in clinic, and eventually they would start coming up to me, "Hey, I got a guy." And they'd want to start telling me about patients. So sometimes I would go into the exam room with them, with the patients. Sometimes they would just refer, and I would see the patient later. And eventually those referrals really picked up. And so I was getting way too busy. So talked with my boss at the time and said, I want to continue to do this in medicine, but I can't do everything. So eventually I stopped doing CL psychiatry. It was half-time pain, half-time medicine. Medicine continued to grow, and then I dropped out of pain management, and then it became full-time for me in outpatient medicine. And again, that was about 20 years ago. So way before patient-centered medical home, or what we call PACT, the patient-aligned care teams at the VA, and way before primary care mental health integration, we were doing it at the Cleveland VA. So when all of these new initiatives came out and people thought they were great ideas, we were way ahead of the curve on that one. So we started, I think, when I was there, I think in behavioral medicine, we may have had 4, maybe 5 individuals in behavioral medicine. And right now, as section chief of health psychology there, I've got 17 health psychologists working for me. And we cover all the medical surgical sides of the house. So from cardiology to pain management to geriatrics to nursing homes to primary care medicine, HIV clinic, hepatitis C clinic. You name the department and we've got people in it.
Mm-hmm.
So.
And you've, for some years now, been very involved in the Ohio Psychological Association. Could you tell us a bit about why you chose to get involved in the state organization and what that has evolved into for you?
I think when I started, I was still in graduate school. And I'd heard about the Ohio Psychological Association. Not much about it, but I heard a little bit. And I also heard that they were working to get hospital privileges for psychologists. And I thought that was pretty cool. So I don't remember how I heard about this meeting, but there was a meeting in Columbus. David Hayes was the chair of that committee. And I don't know if I called him or just found out and showed up. And that was in '86, I believe it was. And that was my first introduction. And so I eventually got involved, and as I got licensed, I participated in other aspects of it and have chaired a number of different committees over time. And then it was probably the mid-90s, I started going to New York. I had joined the Prescribing Psychologist Register organization because I thought, although initially when I started as a psychologist, I had no desire to think about medications, but over time and reading and discussion, I thought this was a good professional move for psychologists to do. So the mid-90s, I started going up, flying up to New York every 2 months. A number of the meetings were at the World Trade Center Marriott, and we'd have class on Saturday, and most of the day on Sunday, take an exam at the end of the day on Sunday, hop a plane and come back to Cleveland. And so on one of those occasions, I stood up during a break and asked for the microphone and asked if anybody was from Ohio, and I think there were 5 of us at the time. So, I said, would it be reasonable if we get together when we get back home and maybe think about starting an organization? So we did. We started the Ohio Prescribing Psychologist Association, OPPA. And it was a small handful of people. We probably got another, 4 or 5 people. Maybe we had 10. And so then I approached OPA to ask if we could have an affiliate relationship, OPPA having an affiliate relationship with OPA. And I believe they said you needed 20 people to have that affiliation. So we contacted a bunch of our friends who were interested in the notion of psychologist prescribing. And so eventually I think we got 25 people. I went back to an OPA board meeting and then presented the names, and there was a pretty significant debate at that time because not everybody was on board with psychologist prescribing, so it was a pretty hot debate.
I was on the board at that point, and I can remember that it was quite a hot topic and some very strong opposition.
Mm-hmm. Yes, indeed. And so it probably took at least 2 board meetings, a couple of board meetings, before there were enough votes to pass that we could become an affiliate relationship with OPA. And so we did. And that was good. And then Michael Ranney started coming to our meetings. And eventually then we moved from the affiliate relationship and it became a task force. So it still is a task force for OPA. So it's been many years since we've gone down that road, and we've had some false starts and good relationships, and we haven't at this point had a bill passed, although we have a good amount of support in the legislature, both the Democrats and Republicans. In fact, there are a couple of Republicans that have been sponsoring a bill for us. The most recent one was the demonstration project with the Ohio Department of Rehabilitation and Corrections. And I think that one we pulled simply because of other political intrigues. But we are now developing a strong relationship with federally qualified health clinics. So it may be that we don't call this a demonstration project, that we are going to open it up completely for anybody that has a master's degree in psychopharmacology, and then try to get people into the federally qualified health centers. So.
Now, you were president of OPA, and I wonder if your involvement in the prescribing issues was one of the motivators to encourage you to run for president, become president.
Yeah, I think that was probably the feather in my cap. At least it got me recognized, rightly or wrongly. And I think some people like the way I handled myself. And I have to say that there have been so many people in OPA that have, again, been mentors to me along the way and helped me along, yourself included. So thank you very much for that. But yeah, just so many people that have helped. And when I was first asked if I would consider running, I thought, I don't know enough about this organization or the politics or anything else. And I think the answer was, well, we'll help you. And indeed, a number of the people did help me along. And I think the way it's set up, where you do the first year as a president-elect, I mean, you're on the executive committee, and you learn a lot. And and then that year of president, you're still learning, but you have your own agenda, and you're able to push some things. And I think during that time, there were a couple of LGBT resolutions that were passed at APA, and came down to us, and we were, again, hotly debating the issues, and some people were not very pleased with those of us that were in favor of these resolutions. But it was debated over a number of board meetings, and eventually we were thankfully able to accept and pass the resolutions. I'm proud of that. I'm glad we were able to do that.
And as I recall, both with the prescription privilege issue and with the gay and lesbian issues, we had members who actually resigned.
Yes, that's true.
And you had to deal with those issues.
Yes, indeed. There were some hotly contested issues that popped up, but I think that's probably true for any president at the time. There's usually something that pops up, and one year, so for me it was those things. Not too far after that it was DOMA. There are budget considerations. There are lots of different things that come up for presidents, but people get through them.
Where do you think the organization and psychologists in Ohio stand now on the prescription privilege issue?
I think if it came to a vote, if OPA were to throw out a ballot to all the psychologists in Ohio and say, should we proceed down this path or not, I'm confident it would pass. Now, if you take the question further and say, which of you in OPA will go through the training and get your master's in psychopharmacology and actually practice if a bill is passed, I think the number diminishes greatly. I think it's partly because of the age of the average OPA member. A few years ago we looked at it and it was my age, so And I'm 60, I'll be 62 in a week or so. So I think a lot of people are towards the other end of their career, and they may not be particularly interested in practicing, but I think they view it as a strong professional issue, and they would support it. I think it is a good path for psychologists to take. But it's like most postdoctoral training. I mean, not everybody's a neuropsychologist, not everybody is a geriatrician, geriatric psychologist. So I think there will be some people that go that route and practice if a bill is passed. I guess I should say when a bill is passed, because I do believe it will. And I think it will be part of our profession.
I remember one of the issues around the prescription privileges was the stance that the university-based training programs were taking. And I wonder if you might say something about that from your historical point of view and where that may stand now.
Yeah, I think our academic colleagues from the beginning were against it. I think some have either come to the point where they see it's going to go that route and have just taken a neutral stance. And there are still some that are dead set against it. I think the reasoning behind it is they viewed it as the medicalization of psychology. The fear was psychologists will just start prescribing and not do psychotherapy. They also were concerned that as the medicalization occurs, that graduate training in psychology will be shifted over to medical schools, and that will be the death of academically based graduate programs in psychology. I don't believe that's true. I don't think it would go that route. I do have strong feelings, though, about the curriculum. I do believe this should remain as a postdoctoral training. And I've heard of late that some graduate programs are including the master's. I think Nova is one, including it within their graduate curriculum. And I think that's a mistake. My argument has always been, we need to learn how to be psychologists first. You need to conceptualize cases as a psychologist first, and then if you need other things to use, whether it's biofeedback, whether it's you choose to use ACT as the form of psychotherapy that you're using, or whether you're using medications. I think it's important that we learn how to think, how to act, and how to conceptualize things as psychologists first, and then use other things on top of it.
It's also an argument for continuing the broadly based internship programs rather than narrowly focusing them.
Yes, I believe that's true. That as far as an internship in psychology, it should be a generalist's curriculum. You may have subtleties in it in terms of what you would like to eventually do. So, like our internship at the VA, it is a generalist internship. But for those that are interested in health psychology, you take a few extra rotations in that. Geropsychology, you may do that. Substance abuse, you may do that. PTSD. But it is considered a generalist training program. And then you can go ahead and do your postdoctoral training in your specialty area. And I think that's a wise choice to do it that way.
Well, Jerry, you've covered a lot of ground from your beginnings and through your years as president involved other committees. Any other memories of your experiences with OPA that you'd like to share with us? Could be humorous as well as serious.
Could be, yeah. I've gone to the convention every year for as long as I can remember, and those are always a lot of fun and certainly educational experiences. I mean, there are a lot of great workshops. And I've used that as an introduction to my learners at the VA, whether they're interns or postdocs, or even new faculty members up there. I'm always talking about OPA and trying to get people to come down. And even Legislative Day, I know Bobby Celeste and I have worked on getting our learners down there. And they generally have a great time and enjoy themselves. And some have even joined OPA. As a matter of fact, the upcoming president of OPA, Kathy Ashton, was one of my interns at the VA, and that's how it all got started with her as well. So it has been an interesting and satisfying, gratifying time to kind of watch people, first introducing them to OPA, watching them grow, watching them develop as professionals, and sitting on committees, becoming president. Even Mike Dwyer and I have switched roles. I mean, I was president first. He was my mentor in undergraduate school, and then I roped him into being president. So, there's a lot of helping up, extending hands, helping people along in both directions, and it's just a lot of fun to see that occur.
Yeah, it's obvious that that's been a major pleasure and reinforcement for you, mentoring those students and professionals as they grew, and getting them involved.
Absolutely.
Well, let's switch gears. You've told us a lot about where you've been. You have some interesting thoughts about where you're going to go, and I'd like you to at least say a few words about that and what you're currently doing. And I should add that you went through a boating phase, which you may want to say something about, but now you're moving into something else, and which I find very interesting.
Yeah, I have, whether it's at the VA or elsewhere, I have a history of reinventing myself. I've always wanted to sail, and a number of years ago, my wife Eileen and I took a sailing class and got a sailboat. It was a 27-foot Erickson, sailed it on Lake Erie, and did that for a number of years, and it was great fun. And we still enjoy sailing, but because of my time commitments at the VA and in this practice at the medical school, I really didn't have much time to sail. So we got rid of that boat. We do have a canoe, however, and I bought sailing rigging for that, and we are sailing that on smaller lakes and having a good time of it. But the other thing I wanted to do was fly. And I always thought it would be a fixed-wing aircraft. And I just knew at some point I would start taking lessons. Well, it's been about a year now, a little over a year. We were in Hawaii, on the island of Kauai, and Eileen and I went up in a helicopter to take a tour of the island, and doors off, and it was a hoot just to watch this guy maneuver this helicopter all over the island, down valleys, starting at the bottom, then going up to the top of waterfalls, which is actually the same waterfall where they filmed Jurassic Park. Over to the coast, and the Pali coast, and it was beautiful, and just the maneuverability of this aircraft just knocked my socks off. So I told Eileen, I said, when I get back, I'm going to look up a helicopter school. And damn if I didn't. So I found a school up out of Burke Lakefront Airport in Cleveland, Precision Helicopters, and called the guy. I said, I'm a little older than probably most of your students, but I want to come down and chat and see if this is feasible. And so I drove to the airport, and we talked for about an hour or so. I said, is it feasible for me at my age to get a commercial helicopter pilot? Can I do anything with it, with that license? And he says, if it was fixed wing and you wanted to fly for United, you'd have to be retired already. You couldn't do it. He says, but as long as you can pass the FAA physical, you can continue to fly commercially. I said, so what can I do? I said, I know I could do tourism. He said, yeah, there's that. You can do surveys of power lines, railroad lines, those sorts of things. I don't know at my age if I would have enough flight hours to do medevacs. I mean, that would be my fantasy, to be able to do that. But we'll see. We'll see. I can even fly for this guy and get my instructor certificate and be an instructor as well. Eileen found something in a newspaper the other day. It was a picture of a helicopter with a tether hanging from it, with a chainsaw with 10 discs on it that was apparently sawing tree limbs off that were touching power lines. So she thought that would be a good job for me. She said that my health insurance was paid up, as was my life insurance. So.
Almost sounds like a return to your years in surgery.
Yes, indeed. Yes, indeed. I've come full circle, apparently. So hopefully, God willing, that'll be my next career path.
Didn't you also have a brief period where you were rowing?
I did. I had a longer period where I was a soccer player.
Yes, you should say a bit about your career as a soccer player and some of the consequences.
Yeah, unfortunate consequences. I started playing soccer in high school after I first played football and had my knee operated on. So I switched to soccer and found that very interesting. And I think the other reinforcement for that was, at the time, Cleveland had the Cleveland Stokers playing. They were the professional soccer team from England, from Stoke City. And their season ends in the spring, early spring. And then for the spring-summer, they would come to the United States, and they played other teams that came over from England as well. So Cleveland had this team from Stoke City, so they called them the Cleveland Stokers. Well, they happened to be living, the team members happened to be living in the same apartment complex where I was living with my parents. So I got to meet these guys. And one guy in particular, his name was Peter Short. He was a midfielder for them. And he and I hit it off, and he was teaching me these moves and what to do, and actually gave me his cleats. Those were my first soccer boots that I had. And so I played in high school. And then after high school, I played another couple of years semi-pro for a team that was up in Broadview Heights, Ohio. And I forget the name of it. Was a Lake Erie League. It was a Lake Erie League. And I think Ted Celeste had something to do with that way back then. Didn't know Ted then, but I think he had something to do with that league. I remember him telling me that. And then I started going to college and then grad school and all of that, so that was taking some time. So I dropped out for a little bit of time, wasn't playing, and then eventually got on a travel team and was traveling around Cleveland, Akron, Canton, and with that team. And just had a great time playing soccer all those years. And then I started playing with a team in Hudson, and enjoyed that as well, playing indoor and outdoor soccer. Until the last 2 years of my career. Within those 2 years, I had 3 major injuries. The first was a hamstring, and while I was recouping from that injury, I decided to put myself in goal and playing indoor, and I tore my bicep tendon, had surgery on that, rehabbed that, went back to play the next year, finished the outdoor season, went back indoors, and tore my Achilles. And with that, I hung up my cleats. So from that point, I thought I needed some other sporting event to participate in. And so started, Eileen too, started rowing for the Cleveland Rowing Association up in Cleveland along the Cuyahoga River. So that too was a lot of fun. It was competitive, and I did that I think for 3 years, up until the time that this thought of helicopters came into my head. And you can't do everything, so I stopped rowing, and I'm taking flight lessons now I usually sign up 4 days a week because the weather is so lousy in Cleveland. I'm lucky if I can get 1 or 2 days to fly. So.
Well, Jerry, we appreciate your sharing all of your experiences, particularly as a member of the Ohio Psychological Association and as president. Any final words that you would have for us at the end of this interview?
I've got about 3 years before I retire, and I would really like to see us pass a bill in Ohio to grant psychologists who have a master's in psychopharmacology the ability to prescribe. I've been working, as you know, we talked about, I've been working on that for a number of years, and I would really, really like to see that bill pass and us have that ability and go down that professional path before I retire.
Well, on behalf of the Ohio Psychological Association and the Oral History Committee, I would like to thank you. And we certainly appreciate your taking the time and sharing your experiences with us.
It has certainly been my pleasure. Thank you very much.